with less hassle. Yes! You can receive monies from your family and friends in UK, Europe, USA, Canada, Switzerland, and the rest of the world with our safe, secure, fast, and convenient service that offers you the largest selection of payout locations in the Gambia. Supersonics Money Transfer. We are currently in 34 African countries and counting, giving you quality money remittance services that are second to none. Visit the Google Play Store or the Apple Store today to download the Supersonics Money Transfer app and enjoy excellent money transfer services only with Supersonics.
Media briefing. My name is Buba Dabo. I am the program manager for health communication. And today I'm here with the program manager for EPI. That's the expanded program on immunization, and also the Deputy Director of Health Promotion with the colleagues from the EPI program, Aja Kande and Musa Kamara. And also we have Sirifo Dabo with us here. Jibril Gando Balde also stepped in. So we have a full team here for you today. As I said, the purpose of calling you here today is to brief you on the plan HPV, that is the Cervical Cancer Vaccination program, that we are about to kickstart by next week. And I think it's very important for the public to know whatever plans we have as far as health interventions are concerned. And when it comes to vaccination, it's even more critical for the information sharing between the health authorities and the public. My task is just very simple, is to chair the meeting. As I introduce the high table, I will give the floor to Sanjali Tarawale to give a quick remark, which will be followed by a statement from Mr. Fofana, the program manager for EPI, and then we will go into the presentation to give you more information about the planned activity that we are about to start, which is the cervical cancer vaccination. The vaccination is a school-based vaccination, actually targeting children at grade 3. More information will be shared with you. And also, we are also targeting children who are out of school.
Let me take this opportunity to thank you all for participating in the receipt of the COVID-19 vaccine last night. Most of you were at the airport, or at least your representative at the airport, to witness the handing over the vaccine. So we thank the media houses for that. Once again, we thank you because we know how much you are contributing in terms of not only immunization program, but in almost all our health intervention program. So we thank you very much for that. For HPV vaccination, it could be recalled some years ago, around 2014, there was this demo in the Greater Banjul area, and in the West Coast region, Kanifing and Banjul, to vaccinate children between 9 and I guess to up to 11 to 13 years. That was the target, and it was successfully carried out. I think we will also thank the Minister of Health because we did the campaign together. We made the assessment. We were trying to find out where we can get the children, and through that assessment, we realized that most of those age category are in school, either informal or non-formal. So that's why we mainly use the schools as an entry point to get to this category of children. I remember in West Coast region, when I was at the Regional Health Directorate, we worked with the Regional Education Directorate, and almost over 90% of the children were seen at the schools. Those out of schools are also covered through our community outreach activity. So basically, this is not the first time. As I said, we did that one in 2014, and just shortly after, some years after we roll out to other parts of the country. So it's just like a continuation of the activity. This vaccination is important because, you know, cervical cancer is happening in country. Women are experiencing the problem, general population. Let's make sure that they get the message. Let's not confuse them. And I know others will keep on putting other messages that may be contrary to what we are saying. But what we are saying, this vaccine is safe and effective. And this is not the first time we are doing this thing. We've been doing this thing. And as I said, always say, vaccination, even for COVID-19, which is a new vaccine, it has been, other countries have been taking this thing since December. So if there should be any major side effect or any adverse effect against this thing, the whole world will have known. So it's almost 2 months into the administration of COVID vaccine. Even some of the information we are hearing are not even factual. They are not true. It has been discovered that some of those adverse effects were not even due to the vaccine, because some of those people had other underlying problems. So for HPV vaccine, please, let's encourage our kids, our girl child to have this thing. And we want to encourage the schools. I think the schools, for some, because they are trying to consult the parents because of the rumors circulating, that's why they want to have consent from the parents for children to be vaccinated. But please, let's spread the message. The vaccine is safe and effective, and it is mainly to protect them from having cervical cancer. That is the message. This is not the first time. Other kids have already benefited. So let's not try to this is another opportunity for this other group of people. So let's not try to do something that will prevent them from having this thing. Otherwise, it may not be accessible to us. So I want to thank you all. And as I said, from here, let's try to disseminate very well, and let's try to report positively. Let's not report in a way that can even confuse the general population. Having said that, I want to thank all of you, and also to thank you for your contribution. You have been contributing a lot. And
we fight over it. But when solution for our problems comes in health, we try to discourage. It's a very funny situation for Africa. And I think the sooner we are able to come out of this, the better. Simply is for protection. If a young girl should take this vaccine at the age of 9 months, 9 years, and it's 2 doses. When you receive the 2 doses, you are protected for life. If you go into the history of venereal diseases, it went as far as from Eve. We are always with these venereal diseases. They spread through, meeting between man and woman. So, but they simply affect women more. We don't have cervix. It's the women that have cervix. So this is where the virus peaks at its favorable environment and thrives there. In thriving there, it damages that aspect of the cancer setting. So we have the know-how, modern generation. And the best thing is to make sure that we try to use this thing to prevent some of these diseases. And as I said, people all those who are spreading false information, they don't ask people. They just come to a conclusion, this is that. Just from the rural areas. And we have poisoning people's mind. We have people, and they don't know they don't have any reason. They just don't come to a conclusion, this is finished. You ask them where you get your information, they will not be able to tell you. So it's a big problem. The Gambia, as they told you here, we set up our national immunization program after WHO set up the global immunization program. Barely 4 years after we set up our national immunization program in May 1979. But thank God, Gambians are very receptive to the idea of vaccination. That is why we are able to make serious headway. Very good, very, very good immunization. Women are very close to our hearts. They are our mothers, number one. Naturally, physically, they are weak. That's why God entrusted them to us, that we should take care of them. God knows very well that women are weak. But there are so many ways that we can help them. Not try to deprive them of vaccine, because vaccination is a right. You deprive somebody because you go to that person and confuse the mind. This is no good. Family planning. When I was doing my campaign, first campaign in this country, I was not married. A typical example, that was a TT campaign, tetanus. Because so many people were dying of tetanus, we say let's protect our women from tetanus. Through vaccination. Who? Only the girls. And the same thing, people started talk. Some people didn't take it. People who confused with family planning method, and they took it, they think it's family planning. The girls, I could remember, a typical example was Gambia High School. They had a lot of teenage pregnancy during that year, because the teacher said most of them thought this was family planning. There is no government who's smart enough to introduce large-scale family planning in your population without their consent. That's not in medical practice. Most of the time, they will always seek consent. If you don't consent, ask for information. If you have your information, you are okay. You'll be empowered. And then definitely we should protect this very small country. We are having enough vaccination in this country. Many people are starting to introduce yellow fever. Yellow fever was introduced in this country in May 1979, as early as EPI itself, because it was the disease that was killing. So some of our friends like USAID were helping the Gambia. They will have a smallpox, yellow fever smallpox team that was going around. So in fact, that's why when they established EPI, this was the team that was automatically brought up to take care of the immunization program. So we are protecting now our children. Dose is expensive, they will tell you, very expensive. If people are volunteering to give you free of charge because they don't want to afford. We are too small. We don't have any mineral here in this country. The only mineral we have here is our human resources. If people are helping us to protect those people, some of us are trying to go and try to behave otherwise. You know, it's not. I always say it's not only dangerous, but it's very sinful. You are going to have it with God, because God said, "Let's protect ourselves and our families." So, with those few words, I want to thank all of you very, very much for turning up today to take up of this information and try to spread it, so that idle minds will definitely become responsible. The responsible people will also be irresponsible, and we close a chapter for HPV. It's very common. It's very common. When we did our sensitization last year, every region, they are here. 1-2 women will come and say, "This is the problem I have. This is the problem I have." Honest to God, I know it's happening, but like at that scale, I never expected. When we are in Kanifing, 4 women will approach you and say, "This you are talking is what is happening to me. In fact, this I'm having. This I am just from Dakar. This I'll be going to Dakar. It's not treatable. Once it reaches that cancerous stage, that the only thing is, God forbid, is death." So with those few words, I want to thank you very much for coming, and I want to count on you as stalwarts in our campaign to ensure that we are able to take the information to the doorstep, because it's print and electronic media. You have the Gambia at hand now.
Public to make sure that we save lives, because this is an opportunity for the poor women, so that the next generation is safe from getting cancer and we minimize some of the risks involved in cancer. We know how painful cancer is, especially those who treat cancer cases, they know. I'm sure none of us have gone through, but we've seen people who die from cancer. So therefore, it is risky. It can be prevented. There are means available before we reach to the tertiary level. Thank you very much.
Funded program on immunization. This program is responsible for all vaccinations in the Gambia, be it routine or any other campaign. So the program, the mandate of the program is to reduce infant mortality and morbidity through vaccination. So we go by this vaccination, the Hpv vaccination. That's the Gambia National Hpv Vaccination, of course the second dose that we are going to talk about more. So this is the presentation outline. We have introduction to human papillomavirus and cervical cancer. We have the Hpv as the human papillomavirus that causes the cervical cancer. We're going to talk about that. We're going to talk about the vaccine itself. We're also going to talk about the vaccination in the Gambia, how we rolled it out. We're also going to talk about the communication and social mobilization. So in depth, what is cervical cancer? What is cervical cancer, or what is cancer of the cervix? It's the same. The part that is affected is where we name the cancer. Right? For example, if it is going to be throat cancer, it is the throat that is affected. The scrotum cancer, we're going to name it after the part that is affected. So in this also, this is the cervical cancer. Simply, it is the abnormal growth in the cervix. Do we all know what cervix is? Cervix is the opening of the uterus. That is the opening of the womb. So usually, it is only found in females. Cervix is only found in females. 300,000 deaths globally. Over 85 of these deaths are also happening in Africa, that is developing countries. So you see how it affects our continent, which the Gambia is part of. Now we trail down to the Gambia. In the Gambia, primary cause of cancer deaths among women accounts for 32% of cancer in women. Of all the cancers, 32 HPV vaccination or HPV cervical cancer accounts for 32%. All the cancer, if you accumulate colon cancer, skin cancer, breast cancer, cervical cancer, prostate cancer. So you see 32% of all these cancers are cervical cancer. So it is a very high number. So of this 12% prevalence of HPV, among all these cancers also, the 12% of these cancers, that is the 32 cancers of cervical cancer, are caused by the HPV virus. There are other cancers also caused by different other viruses. But the HPV virus is responsible for 12% of this cancer. And this is a study done in the country in 2018. So human papillomavirus is the main cause of cervical cancer, as I said. The HPV is responsible for cervical cancer. HPV is a common virus, easily spread by skin-to-skin contact during sexual activity with another infected person. So it is caused by influenzas are also viral diseases. So in influenza, it's like HPV is like another influenza because there are so many that you have to assign numbers to them. And the same like influenza. There are very huge numbers of the virus. But among them, 13 of these viruses are high-risk type. 13 of these viruses are high-risk type. And the high-risk types, also among them, that prevail in the country are type 16 and type 18. Am I communicating? So among the 13 high-risk in the world, those that are prevalent in the Gambia are type 16 and type 18. Okay? So and this type 16 and type 18 accounts for encourage among us to be faithful so that one does not pick infection from one partner to another. The family history, we know cancers are non-communicable diseases. They can also be part of the family history. All cancers and other non-communicable diseases are likely to also be transferred to our offspring. So smoking is part of it. All cancers, smoking is a risk factor to all cancers. Diet in this sense, we mean the chemicalized foods. The chemicalized foods. We know some of our drinks, some of our foods are being chemicalized. So we also have a watch on what we eat. Multiple pregnancies. We know multiple pregnancies with little spacing can cause the uterine or the uterus to be very light and prone to infections because it is already very exposed to delivery all the time, so there is exposure to infections. So the low socioeconomic status would also increase in the time when you don't have much to eat. Sometimes you become malnourished. There are also chances for you to develop some infections because without vitamins, sometimes you cannot fight simple infections. So it's important that we talk about our diet. Impact of cervical cancer on women. The impact is not a positive impact. All the impact on cervical cancer on women is negative. So a major health, psychological, and social burden for women everywhere. If somebody is bleeding all the day, you cannot socialize, or you cannot even pray, and you cannot also practice your matrimonial duties. This is a stress or a stressful situation for women. So we all know, more likely to cause slow and painful death due to late diagnosis and lack of access. Do not see menses, that is menopause. So in that, even after the 60th or 70th year, you still menstruate, which is telling you that something is wrong. Increased vaginal discharge. For all the discharges, I am saying they are not normal. No discharge is normal. Any discharge you see, note that it is infection that has taken place. There is infection. So anytime you see discharges in a large quantity, please rush to the health facility for treatment. It is not normal. So we have bleeding and pain during intercourse. We will come to know why the bleeding and the pain, because that area has been wounded already. The cancer has started. So blood in the urine or stool, it will go into the urine or into the stool. The blood will have to flow. Pain in the lower abdominal and the lower back pain or pelvic pain. It will also affect, because the area that is affected is around the back and around the pelvic. So that is the organ where it is affected, so it will affect the entire area. Swelling of the leg. Of course, there is going to be swelling because when the bleeding occurs, there is inflation or high amount of fluid on the legs. Because of the bleeding, it will leave the normal vessel, the blood vessels, and go to the tissues and increase the number of fluid there. So therefore, creating swelling on the legs. Fever, weight loss, vomiting, constipation, and lack of appetite. These are all signs and symptoms. So we come to know about this. These are real life pictures. They are not just pictures or diagrams that we want to talk about. These are real life pictures. Talking about the cervix, as I said, is from this point to this point, and that is what is given here. This is the cervix. So in the cervix, this one is very normal. You see, attached to some risk also attached to this. We all know operations come with risk. So there are so many risks that are attached to this. So we don't want to get to this position. With this one, we cannot do anything, just to give paracetamol. If you have fever, give paracetamol. And with pain, we cannot do, just to give you more painkillers. There's nothing that can be done. Already is damaged. Huh? So the good news about this disease is that it has a preventive means by vaccination. So a preventable disease through vaccination, it is HPV. Early detection is also possible, and then timely treatment of precancerous lesions are also possible, as I said, to avoid the development of cancer. But once the cancer is developed, we cannot do much about it. And as Mr. Jago was saying, that we have a very expensive treatment in some of the other countries, like in Senegal. Sometimes what happens when we say this person is suffering from cancer, they will say rush her or him to Dakar, which sometimes, most of the time, the person will not come alive, in most cases. So when we talk about the vaccine, the cervical cancer, the reason or the rationale of giving the vaccine to age 9 to 14 is because the vaccine is highly effective, looking at the curve, with ages 9 to 14. Can we read the graph? The HPV vaccine is highly effective in this and has been tested worldwide. This is why it is targeting this age bracket. So with the screening, also, is highly effective in the ages 20 to 30. By the way, how many of us have been screened? It's an annual screening that we do in major health facilities. And it's free of charge, please. So these married women can go for the screening. 20 or 30 years is also higher than the rest of the population in screening. But as well, the precancerous treatment is also among this age bracket, because we know already the infection have started and there is precancerous epithelial neoplasia, VIN and VAIN, and also genital wart. So we have 3 conditions that the vaccine can prevent. So population level effectiveness demonstrated in many countries around the world after vaccine introduction. There are so many research or studies done on the effectiveness and the efficacy, the safety of the vaccine. Current evidence suggests long-term protection and no evidence of waning immunity. All the studies, the recent one also said there is no problem with other immunity aspects with the vaccine. If we give the vaccine, you are as immune as any other, the level of immunity with other vaccines. So the vaccination in the Gambia. The HPV vaccine was demonstrated in the West Coast region of the Gambia from 2014 to 2016 among girls in grade 3. And in the demonstration, we were testing what model we were going to use. Now that we know the model, that is school-based strategy, and outside, out of school, we are giving an extra age to girls who may be 1 year older. So the vaccine was successfully implemented in school-based setting. The vaccine has been rolled out nationally in November 2019. And these were the grades that we are targeting. When we say demo areas, we are talking about the West Coast region. The non-demo areas, we are talking about other regions, like CRR, LRR, URR, North Bank West, KM, and Banjul. Those are the other regions that we are talking about. So those are the non-demo areas. Because in 2016 was the last dose that was given in the demo. We were supposed to roll it out in 2017, 2018, 2019. We didn't. So we failed in some of the students, getting some of the students. So we decided to take those students as multi-age cohort. Those are now in grade 3 or grade 4, grade 5, grade 6 in demo areas. And the population that we are targeting, This is HPV-1 population target and HPV-2 population target. In going to target 34,104. We are targeting 34,104 girls in school. And out of school, we are targeting about 696 girls, which is said to be 2% outside the 2% of the girls' population who are out of school, based on statistics. Huh? So the total girls that we are expecting to vaccinate for this year for their first dose is 34,800. When you come to the second dose, last year, or 2019, we vaccinated 119,406 girls. So these girls, in order to be fully protected, we should give them their second dose. But because the interval what we planned for was 1 year, then the COVID stroke, we couldn't do anything. So now we are coming to get them their second dose. You understand? In school, we are targeting 114,629. Out of school, we are targeting 4,777. So in total, we are targeting for the second dose 119,406. The first dose is targeting 34,800. So if you cumulate dose 1 and dose 2, we are generally going to target 154,206 girls nationwide. Is that clear?
No, I don't understand. You mean last year you vaccinated, is it the 11,000?
119,406 were vaccinated. They already received the vaccine for their first dose. So we will follow them up for their second dose so that they will be fully protected. This year as well, we are targeting these people as their first dose. You understand? So it's like if you add the first and second dose that are concerned. So orientation of regional TAC, advisory committees at the governors level were orientated, the TACs were orientated. Orientation of cluster monitors, head teachers, including madrasas. So most of the, I can say 50 or maybe up to 70% of the head teachers were orientated on the HPV. And the parent-teacher associations were also mobilized and they were orientated on, including the school management committees. Orientation of Supreme Islamic Council, which was done a week ago, and then orientation of regional religious leaders was also conducted just over the weekend. So the training of health workers as well was also done so that they will refresh them on how to use the vaccine and how to manage the vaccine. So materials are developed and will be distributed to schools for use in communicating with girls and their parents. The materials are leaflets, posters. This time around, it's a bit late. We couldn't share with you. They will also have engaged TV and radio spots to be aired in some of the radio stations. So the key message is here. We know already there is rumor to say there are people who will be vaccinating the COVID vaccine in school. They are not our target for COVID vaccination. Schools are not our target. In fact, any child under 16 is not a target for COVID, please. Huh? So the vaccine